It's 3 a.m. and you're wide awake again, sitting on the edge of your bed, with that all-too-familiar burning sensation creeping up your throat, that acidic taste filling your mouth, and the frustrating realization that this is the 4th night this week you've been jolted awake by heartburn that seems to strike at the worst possible moments. You've tried sleeping propped up on multiple pillows, you've avoided spicy foods for dinner, and you've even tried going to bed earlier, but nothing seems to prevent those middle-of-the-night episodes that leave you exhausted and dreading bedtime. If you're over 50, and this scenario sounds painfully familiar, you're not alone in this struggle because research shows that nearly 60% of adults in this age group experience regular nighttime heartburn, with symptoms that are often more severe and persistent than daytime episodes. I'm Dr. Grace Nakamura, a gastroenterologist with over 15 years of clinical experience helping patients overcome age-related digestive challenges naturally. Tonight I'm going to share with you one specific nighttime habit that, when performed correctly, for just 10 minutes before bed, can eliminate your nighttime heartburn completely and help you wake up feeling refreshed and comfortable rather than exhausted and in pain. What makes this nighttime habit so uniquely effective for people over 50 is that it addresses the specific physiological changes that occur in our digestive system as we age. After 50, our stomach acid production often becomes irregular. The lower esophageal sphincter may weaken. The protective mucus lining of our digestive tract can thin out, and our body's natural repair mechanisms slow down significantly during sleep. These age-related changes create the perfect storm for nighttime acid reflux, which is why conventional approaches that might work for younger people often fail to provide lasting relief for those of us in this age group. Before I reveal this powerful nighttime habit, I want to ask you to help me reach other people over 50 who are lying awake right now, searching for a solution to their nighttime heartburn. If this technique helps you sleep through the night without waking up to acid reflux, please give this video a thumbs up and consider subscribing to my channel, where I share evidence-based natural solutions specifically designed for the unique health challenges we face after 50. Your engagement helps me reach more people in our age group who are suffering unnecessarily from digestive issues, and it shows me that this content is making a real difference in the lives of people who need it most. The nighttime habit I'm about to teach you is called the Digestive Reset Ritual, and it consists of 4 specific steps that must be performed in the exact sequence I'll outline, beginning precisely 60 minutes before your intended bedtime. This timing is crucial because it allows each component to work optimally while giving your body enough time to process and respond before you transition to sleep. The entire ritual takes only 10 minutes to complete, but its effects last throughout the entire night and often extend into the following day. Step 1 of the Digestive Reset Ritual begins exactly 60 minutes before bedtime and involves what I call the acid neutralizing elixir. This is not just another home remedy, but a scientifically formulated combination that addresses multiple causes of nighttime heartburn simultaneously. In a small glass, combine 6 ounces of room temperature filtered water with 1 teaspoon of raw, unfiltered apple cider vinegar, 1 teaspoon of raw honey, and a pinch of high-quality sea salt. The apple cider vinegar might seem counterintuitive for heartburn, but research shows that many people over 50 actually have low stomach acid rather than high acid, and this creates a cascade of digestive problems that paradoxically cause more severe acid reflux symptoms. The preparation of this elixir requires attention to detail for maximum effectiveness. The apple cider vinegar must be raw and unfiltered, containing the beneficial bacteria and enzymes known as the mother that support digestive health. The honey should be raw and unprocessed, preferably from local sources, as it provides natural enzymes and forms a protective coating along the esophageal lining. The sea salt should be unrefined and free from anti-caking agents, providing trace minerals that support proper stomach acid production and regulation. Stir this mixture thoroughly and consume it slowly over a 5-minute period, allowing each sip to coat your mouth and throat before swallowing. Step 2 occurs 45 minutes before bedtime and involves the digestive pressure point massage, a technique based on traditional acupressure principles that stimulate specific nerve pathways related to digestive function. Begin by finding the point located 3 finger widths below your navel, directly in the center of your abdomen. Using your middle finger, apply gentle but firm pressure to this point while breathing deeply and slowly. Hold this pressure for 30 seconds. Release for 10 seconds. Then repeat the cycle 5 times total. This pressure point, known in traditional medicine as the sea of energy, helps regulate digestive function and can significantly reduce nighttime acid production. Next, locate the point on your inner wrist, approximately 2 finger widths, from the crease where your hand meets your wrist, in the center between the 2 prominent tendons. This is the naguan, or inner pass point, which has been clinically proven to reduce nausea and acid reflux symptoms. Apply steady pressure with your thumb for 1 minute on each wrist, using small circular motions while maintaining the pressure. Many of my patients report immediate calming effects from this technique, along with reduced digestive discomfort throughout the night. The final pressure point is located on your foot, in the soft depression just below the ball of your foot, directly in line with your second toe. This point, called the stomach 44, or inner courtyard, specifically addresses stomach acid regulation and digestive inflammation. Apply firm pressure with your thumb while flexing your foot gently, holding for 45 seconds on each foot. The entire pressure point sequence should take approximately 8 minutes to complete and creates a profound calming effect on your entire digestive system. Step 3 begins 30 minutes before bedtime with the digestive breathing protocol, a specific breathing technique that activates your parasympathetic nervous system and optimizes your body for restorative sleep while preventing acid reflux. Find a comfortable seated position with your spine straight and your feet flat on the floor. Place one hand on your chest and the other on your abdomen, just below your rib cage. This positioning helps you monitor your breathing pattern and ensures you're breathing deeply from your diaphragm rather than shallowly from your chest. Begin by exhaling completely through your mouth, making a whooshing sound as you release all the air from your lungs. Close your mouth and inhale quietly through your nose for a count of 4, feeling your abdomen rise while keeping your chest relatively still. Hold your breath for a count of 7, maintaining a relaxed state without creating tension. Finally, exhale completely through your mouth for a count of 8, again making the whooshing sound and feeling your abdomen fall. This completes one cycle of the 4-7-8 breathing pattern, which has been shown to activate the vagus nerve and promote deep relaxation. Repeat this breathing cycle 8 times initially, though you can work up to 16 cycles as you become more comfortable with the technique. The extended exhale phase is particularly important for people over 50 because it stimulates the parasympathetic nervous system more effectively than shorter breathing patterns. This breathing protocol not only prepares your digestive system for sleep, but also helps reduce overall stress and anxiety that can contribute to nighttime heartburn episodes. Let me pause here to address something that many people over 50 experience, but rarely discuss with their healthcare providers. How many times have you felt frustrated and defeated because your sleep quality has deteriorated so much that you're afraid to go to bed, knowing that heartburn will likely wake you up in a few hours? How often have you wondered if this is just something you have to accept as a normal part of aging, watching your energy and vitality diminish because you're not getting the restorative sleep your body desperately needs? As a gastroenterologist who specializes in age-related digestive issues, I see this despair in my practice every day. And I want you to know that nighttime heartburn is not an inevitable part of getting older. Your body still has an incredible capacity for healing and comfortable sleep when given the right tools and conditions. I want you to share in the comments below, "My nighttime heartburn has robbed me of," and tell us about something important that sleep disruption has taken away from you. Your honesty could help someone else realize they don't have to accept this as their new normal. Step 4 is the final component of the digestive reset ritual and takes place in the 15 minutes immediately before getting into bed. This step involves the gentle digestive massage, which helps stimulate lymphatic drainage, reduce inflammation, and promote proper positioning of your internal organs for sleep. Begin by lying on your back on a comfortable surface, such as your bed or a yoga mat, with your knees slightly bent and your feet flat. Start the massage by placing both hands on your lower rib cage, just below your breastbone, where your ribs meet. Using gentle but firm pressure, make slow circular motions clockwise around your entire abdomen, following the natural path of your digestive tract. This clockwise direction is important because it follows the flow of digestion from your stomach through your small intestine and colon. Continue these circular motions for 2 minutes, breathing deeply and allowing your abdominal muscles to relax completely. Next, place your right hand on your upper abdomen, just below your left ribs where your stomach is located, and apply gentle downward pressure while taking deep breaths. This helps position your stomach optimally and can reduce the likelihood of acid escaping upward during sleep. Hold this pressure for 1 minute, then move your hand to your lower abdomen and repeat the gentle pressure for another minute. This massage sequence helps reset your digestive organs and creates optimal conditions for comfortable sleep. The timing and consistency of this 4-step digestive reset ritual are absolutely crucial for achieving the best results. Each step must be performed at the specified time intervals to allow your body to process and respond appropriately. Most importantly, this ritual must be performed every single night for at least 21 days to establish new neural pathways and allow your digestive system to adapt to this new routine. Many of my patients notice some improvement within the first few nights, but the most dramatic results typically occur after 2 to 3 weeks of consistent practice. The room environment where you perform this ritual can significantly enhance its effectiveness. Keep the lighting dim during the entire hour leading up to bedtime, as bright lights can interfere with your body's natural production of melatonin and disrupt the relaxation response we're trying to create. The temperature should be slightly cool but comfortable, ideally between 68 to 72 degrees Fahrenheit. Remove electronic devices and distractions from your bedroom during this ritual, as the blue light from screens can counteract the parasympathetic activation we're working to achieve. Dietary considerations in the hours before performing this ritual are important for optimal results. Avoid eating anything for at least 3 hours before beginning step 1 of the ritual, as food in your stomach can interfere with the acid balancing effects of the elixir. If you must eat something due to medication requirements or blood sugar concerns, limit yourself to a small amount of easily digestible food, such as a banana or a few almonds. Avoid alcohol, caffeine, spicy foods, and citrus fruits for at least 4 hours before starting the ritual. The quality of ingredients used in the acid-neutralizing elixir can make a significant difference in the ritual's effectiveness. Apple cider vinegar should be organic, raw, and unfiltered, with visible sediment at the bottom of the bottle, indicating the presence of beneficial enzymes and bacteria. Raw honey should be thick and may be crystallized, which indicates it hasn't been processed or heated. If you have diabetes or are monitoring blood sugar levels, you can substitute the honey with a small piece of fresh ginger, which also provides digestive benefits and natural anti-inflammatory properties. For people taking medications, especially those common among adults over 50, timing considerations are important. blood pressure medications, heart medications, and diabetes drugs may need to be timed differently relative to the elixir consumption. The apple cider vinegar can potentially affect the absorption of certain medications. So discuss this ritual with your healthcare provider if you're taking prescription medications regularly. Generally, it's safe to take medications either 2 hours before or 2 hours after consuming the elixir to avoid any potential interactions. The pressure point massage component may need modifications for people with certain health conditions. Those with recent abdominal surgeries, hernias, or other structural issues should consult with their healthcare provider before applying abdominal pressure. People with neuropathy or reduced sensation in their hands or feet should be extra gentle with the pressure point techniques and may need assistance from a partner to ensure proper pressure is being applied. The breathing protocol is generally safe for most people, but those with certain respiratory conditions may need modifications. People with chronic obstructive pulmonary disease, severe asthma, or other breathing disorders should start with shorter breath holds and gradually work up to the full 4 to 7 to 8 pattern. If you feel dizzy or lightheaded during the breathing exercises, reduce the breath hold times or take breaks between cycles. Sleep positioning after completing the digestive reset ritual can enhance its overnight effectiveness. Elevate the head of your bed by 6 to 8 inches using blocks under the mattress or a foam wedge pillow specifically designed for acid reflux relief. Sleep on your left side when possible, as this position takes advantage of your stomach's natural anatomy to prevent acid reflux. Keep a glass of room temperature water by your bedside in case you need small sips during the night, but avoid drinking large amounts that could trigger reflux episodes. The long-term benefits of this nightly ritual extend far beyond heartburn relief. Many of my patients report improvements in overall sleep quality, reduced morning stiffness, better energy levels throughout the day, and enhanced mood stability. The stress reduction benefits of the breathing and massage components can have positive effects on blood pressure, immune function, and cognitive performance. The digestive improvements often lead to better nutrient absorption, which can enhance overall health and vitality. Seasonal and environmental factors can affect the ritual's effectiveness and may require minor adjustments. During winter months, when indoor heating creates dry air, you may need to add a humidifier to your bedroom to prevent throat irritation that could worsen nighttime reflux. Summer heat and humidity might require adjusting the room temperature or using lightweight, breathable sleepwear to maintain comfort during the ritual and throughout the night. Travel and schedule disruptions are common concerns for people over 50, and the digestive reset ritual can be adapted for different environments. Pack the necessary ingredients for the elixir in travel-sized containers, though you should check airline regulations if flying with apple cider vinegar. Hotel rooms can be used for the pressure point and breathing components, and even a modified version of the massage can be performed in a chair if bed space is limited. Maintaining consistency with this ritual, even while traveling, can prevent the digestive disruptions that often accompany schedule changes. The relationship between this nighttime ritual and other aspects of healthy aging is significant. Regular practice of these techniques can improve your body's overall stress response, support immune function, and enhance your ability to adapt to the various challenges that come with aging. Many patients find that the discipline required to perform this ritual consistently also motivates them to make other positive health changes, creating a cascade of improvements in their overall well-being. It's important to understand that while this digestive reset ritual is highly effective for most people over 50 with nighttime heartburn, persistent or severe symptoms may indicate underlying conditions that require medical evaluation. If you experience heartburn more than 4 times per week, have difficulty swallowing, notice blood in your stool or vomit, or have symptoms that don't improve after 4 weeks of consistent ritual practice, consult with a healthcare provider immediately. These could be signs of serious conditions such as Barrett's esophagus, esophageal strictures, or other digestive disorders that need professional medical treatment. The cost-effectiveness of this natural approach compared to long-term medication use is particularly relevant for people over 50 who may be managing multiple health conditions and medication costs. The ingredients for the elixir cost less than $1 per day, and the other components of the ritual require no ongoing expenses. Many patients are able to reduce or eliminate their dependence on acid-suppressing medications after implementing this ritual consistently, though any medication changes should always be made under medical supervision. Creating accountability and motivation for maintaining this nightly ritual can be challenging, especially when results may take several weeks to fully manifest. Consider keeping a simple sleep and symptom journal for the first month, noting which nights you complete the full ritual and any heartburn episodes you experience. This tracking can help you identify patterns and stay motivated as you see improvements develop over time. Many people find it helpful to involve a spouse or partner in the ritual, creating mutual accountability and support. As we conclude today's discussion, I want you to understand that tonight can mark the beginning of a new chapter in your sleep quality and overall health. The digestive reset ritual I've shared with you represents years of clinical experience working specifically with patients over 50 who were desperate for natural solutions to their nighttime heartburn. This isn't just another temporary fix, but a comprehensive approach that addresses the root causes of age-related acid reflux while supporting your body's natural healing mechanisms. Starting tonight, I encourage you to implement this 4-step ritual exactly as I've described, beginning 60 minutes before your intended bedtime. Prepare your acid-neutralizing elixir. Perform the digestive pressure point massage. Practice the digestive breathing protocol, and complete the gentle digestive massage. Give your body the gift of this nightly reset and prepare to wake up tomorrow morning feeling more rested and comfortable than you have in months or even years. If this information has been valuable to you and you're ready to take control of your nighttime comfort, please show your support by giving this video a thumbs up and subscribing to my channel. I regularly share evidence-based natural solutions specifically designed for the health challenges we face after 50, and your engagement helps me reach more people in our age group who are struggling with similar issues. Remember, you don't have to accept nighttime heartburn as an inevitable part of aging. Your body still has an incredible capacity for healing and comfortable sleep, and this digestive reset ritual can help you reclaim both starting tonight.